I understand the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
Hi, my name's Sheri. I'm going to be your nurse today. Can you tell me your first and last name and your birth date?
Susan Smith.
Okay, would you like me to call you Mrs. Smith, or do you go by Susan? Or
Susan's fine.
okay, Susan. Well, what brings you in today?
My chest has been all congested, I've been coughing a lot, and I've just felt the fever come on.
Okay, and how long has this been going on for?
The cough's been about a week, and the fever is just in the last 2 days.
Okay, and they told me you haven't been having any chest pain.
No.
Right?
No.
Okay. Okay. All right. Well, what I'm going to do, I'm going to do an assessment on you from the nursing standpoint, just kind of assess your respiratory status. Do you have any cultural or spiritual considerations that I need to be aware of before I do my assessment?
No.
Okay. All right. Well, I'm going to have you go ahead and uncross your legs and just sit up straight for me. Okay. The first thing I'm going to do is just kind of give you a general look over. I'm just kind of looking at your chest and your back, and looking at your skin and just making sure you have a good skin color. Your skin's warm. You've been running a fever.
And we just noticed it last night, and it just...
Okay. All right, and I'm going to check your capillary refill, and it's fine. It kind of shows how your oxygen is perfusing through your body, and it's doing just fine. And I do see your vital signs. Your oxygen saturation is 91%. Respirations are 24. Your heart rate is 106, and you do have a temperature of 103. Your blood pressure is normal at 138/61. The one thing we are concerned about is your oxygen saturation is just a little bit borderline low. We like to see it above 94%.
Oh, okay.
Okay, so I've inspected, and I've noticed that your breathings are regular and even, equal. The shape of your chest and your back is equal and regular. I'm just going to kind of be touching you all over here, palpating. And what I'm doing is just seeing if I feel any air underneath your skin or any masses, or see if it's tender anywhere. Anything hurt when I touch on it?
No.
Okay, so the next thing I'm going to do, I'm just going to kind of tap a little bit. And what we do is we listen to see if there's changes. Okay, so I'm going to go ahead and get my stethoscopes out. And I'm going to have you just take deep breaths in and out for me. Okay, I'm going to listen to your back now. Okay, very good, Susan. You're doing good. You can go ahead and relax.
All right.
Okay. Is there any stress or any problems at home that you'd like to discuss?
Well, just the biggest thing was coming in here, not wanting to come just because I don't have insurance.
Okay.
And it's the financial aspect
Okay.
of that. So
I can understand that.
Yeah.
What we can do to help you, I can call a social worker and a caseworker for the hospital, and they can come down and talk to you and see if you can qualify for some programs to get some help with the finances, okay?
Okay.
Do you live at home alone, or do you have family at home?
No, I have family. I have a husband and teenagers.
Okay, all right. So if for some reason you're admitted today, then your husband will be able to take care of the kids?
Yes.
Okay.
Yes.
If you need to get that, go ahead.
No, that's okay. Then.
Okay. All right. And then I'll tell you what the plan is. The doctor's going to be ordering a chest x-ray. He's going to be ordering some blood work to check for infection and just general things. Since we live here in Arizona, we're also going to check you for valley fever.
Oh. Okay.
And then the treatment, Since it is flu season, we'll probably get a flu swab, and we'll check for all those. With your symptoms and everything, it's most likely that you'll probably be admitted to the hospital, and you'll be getting some IV antibiotics, maybe a little bit of oxygen and some steroids. The respiratory therapy will also be giving you some breathing treatments, and we'll get you feeling better.
All right.
Okay, do you have any questions about anything?
I don't think so. I guess I just wasn't expecting to be admitted, but
Okay.
thank you.
Well, we're going to take real good care of you, and we're going to get you feeling better, okay?
All right.
Okay, thank you, Susan.
Thank you.